The Nigerian government wants to reduce the number of health workers leaving the country, especially doctors. It aims to do so with a bill in Parliament which is expected to become law before the end of the year. The government says this has become necessary in its bid to combat the coronavirus pandemic. Correspondent Tessa Makende reports.
Mwasma Shaw is a medical doctor in Jos, north central Nigeria, who has been practicing medicine for 11 years. He says his stay in the country is tentative because he's hoping to earn better wages and work in a more advanced environment abroad.
You go to where the pasture is greener. So as soon as I get the opportunity to, I would love to leave as well. There are others that have stayed, and they have stayed in the service of the nation for a long time, to the point that they have become professors. But even as at that, they are leaving.
The Nigerian Medical Association says at least 4 doctors leave the country every month, while 8 out of every 10 of them are contemplating leaving the country. Nigeria's health sector has a history of strike actions by health worker unions, calling for better welfare and working conditions.
There needs to be good pay for the workers, good working environment, and good working environment, and the assurance that your safety is guaranteed. The payment of the doctors and other health professionals, medical laboratory scientists, the nurses. There are many of them complaining, but as if nothing is being done about it. So what we have in most cases are promises.
Lawmakers of the National Assembly are now deliberating on a bill that limits the exodus of health workers and addresses their remuneration concerns. But some experts don't think the bill is necessary.
What about those that are in charge of our finances, those that are in charge of our policies? What bill is there to stop them from taking their children out for schooling? What bill is there to stop them from going out to seek for help? That is what we should be concerned about. If a bill to stop the health professional from going out is to be instituted or be passed, then a bill should also be passed that will stop a politician, an average politician, from going out to go and seek for health care.
The Nigerian government has repeatedly called for more patience and commitment from the doctors as the country battles the coronavirus. The government also says it is engaging unions in the health sector on how to do more in funding hospitals across the country and motivate health workers. It has made the medical residency program free for resident doctors and instituted an insurance scheme for health workers across the country. This, it hopes, to go a long way to discourage the exit of workers like Mwasma Shaw from the country and ultimately boost its medical sector. Tessa Makende, CGTN Jos, Nigeria.